Health Connect went to where people were.
It meant to them, I think, a stepping stone to be able to actually access care.
I think we were able to at least show a microcosm of the need of the community.
What I know to be true is that wherever they touched, it was giving a sense of hope to people that might not have had that sense of hope for what they needed.
Hi, I'm Maria Royce. I'm one of the senior leaders at WellSpan, and I'm here with Dan Waltersdorf. Dan's one of our board members and a longtime supporter of the organization. And we've been sitting here thinking about, well, 15, 20 years ago, and what was going on in our communities. And it's really interesting. Today, a lot of healthcare organizations have started to do community health assessments and try to determine what needs their communities have and how those health systems can meet those needs. We were a leader in that, and it's been 15, 20 years ago that we did our first community health assessment and found out that the issue of access to care to people who couldn't afford it was a real barrier in our communities. And from some initial assessment, our foundation and our community leaders began looking at different programs around the country that we could develop to meet that need.
I think this was one of the first rollouts in the country, if not the first, maybe the second or third. I remember when it came to our committee and we looked at various options to provide to the community for access. And yeah, I think this is one that we really got excited about. And it's hard to believe it's been 15 years ago, but we got excited about raising the money. That was in 1999 when we first came up. Well, I guess the idea came up actually earlier than that, but it was 99 when we rolled out the van to the community to provide access to the uninsured, underinsured folks in York and Adams County. So it was an exciting time.
It was able to help people get that link to where they needed to go next, to be able to secure health care. We had 13 sites in the community between York and Adams County that we would go to see patients to meet them where they are at the curb, so to speak.
It gave us the flexibility to figure out where the need in the community was and meet that. And then always, when we could, figure out how to connect them to our more traditional services so they had access to the services that everyone else had access to.
The van was there on a regular basis. People could count on it. Not in a way you count on a regular physician's office in that there were people on call or somebody there every day, but certainly there was a presence that could be there every week or once a month.
When we came up with Kids First and we came up with the idea of the van, getting it out into the community to help get the kids the help and both dental help and health care that they needed. We needed to raise the money in the community to do it, and we've been, like you say, we've been successful for 15 years at raising money through the community to help support the full operation of the van.
What was presented to us was that there are different parts of the York County that people can't get to the doctor. So they were going to bring the doctor to them by having this Health Connect van, and we supported that. We bought the van. Over the years, we awarded them over $567,000 to buy the van and to support it and continue it.
There were some of the original donors, Harley Davidson, the Young Women's Club of York. Their investment then created the program that would last for 15 years, that would have learning, that would actually help us not just provide the Health Connect program, but transform our health care for tens of thousands of people. Health Connect was, again, a great example. It was mobile, it could change, we learned from it. But at this point, we have the capability within our patient-centered medical homes and healthcare network to serve more people in a better way.
Now there are a lot more opportunities as far as urgent cares, Care Express. I think our medical group has expanded. Many more offices are out there accepting patients. We have more doctors in the area.
Is there still a vulnerable population? Yes. But I think as a community, we're far better able to mobilize around that. There's a better awareness and a better system to be able to support people and to go out and reach them. So I think Health Connect enabled us to do that.
It's been really fun to look back on 15 years and the impact that a program like Health Connect has had on the community in helping people connect to health, regardless of what they can afford.
What it says about WellSpan, and I really believe this, that there has been support for programs like Health Connect, Healthy York Network, Healthy Community Pharmacy, the things through Community Health and Wellness. There has been this commitment to everybody. So when the mission statement says, when they say all, I think WellSpan means it.
I feel my calling is to work with the underserved or vulnerable population. So to be able to work in an organization that helps us do that and helps us continually evolve that, I think is exciting.
Professionally, personally, emotionally, to see those successes is what keeps me going. I love taking care of individual patients. I also love taking care of communities because it's the community that I live in too. And to make that healthier is only better for all of us.